Thank you for joining us for the third annual Global Summit, Global Kidney Innovations, Expanding Patient Choices and Outcomes. This is a collaborative partnership between the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. I'm Lana Schmidt. I'm an AAKP board member, I'm on the executive committee, and I'm an AAKP ambassador. As an 18-year kidney patient warrior on dialysis for over 13 gruesome years, and now a 5-year kidney transplant recipient, I know firsthand what it's like to try and get your head wrapped around the idea that unless you get a transplant, there is no other option except to stay on dialysis until you die. A very sad reality. We need a surge of research into kidney disease and transplantation to stop patients from uselessly suffering and prematurely dying because we don't have the proper medical care in place. Kidney patients have started to speak up about their need for improved medical care, demanding more research and more options to receiving a kidney transplant so that they can have a productive life. Being part of AAKP has offered me the opportunity to have my voice heard and raise kidney awareness from a patient perspective. I've been able to publish articles in magazines and newspapers, conduct TV and radio interviews, speak on kidney disease issues, participate in webinars, meeting with my congressmen and my senators on Capitol Hill and virtually, being a part of research studies, and so much more. Join AAKP, whether you're a kidney patient, a caregiver, a nephrologist, a surgeon, a nurse, a doctor, a social worker, a dietitian, so that you can be a part of raising the level of medical care for kidney patients. Today, I am pleased to introduce an AAKP ally and partner, Katharina Schreib, Senior Director, Head of Autoimmune and Oncology at Sangamo Therapeutics, for our session on Emerging Research with Global Implications, Personalized Cellular Therapy to Advance Kidney Transplantations. Ms. Schreib, you may start your presentation.
Hello, everybody. I'm very excited to present you today some of our programs at Sangamo. My name is Katharina Schreib. I'm the Senior Director, Head Autoimmune and Oncology Clinical Science at the company Sangamo. We are a genomic medicines company committed to translating groundbreaking science into medicines that should transform the life of patients with serious diseases. Here you see some of our programs in rare diseases, CNS, oncology, and autoimmune indications. So, some time ago, Rachel and Jonathan shared with us their experience around kidney transplant. We are really grateful to work together with the kidney disease patient advocacy community like the AAKP to learn about the experience of patients and also collaborating with you in developing a better patient-facing material like ICFs or even study protocols. So today I would like to present you one of our programs, the so-called Steadfast program. When patients are transplanted with kidneys, it sometimes happens that the kidney transplants are mismatched. So patients need to receive a transplant which is not actually having the same immunological marker as their body. This happens in 21 to 26% of all transplanted organs. And our goal with the program, the TX200 product, is to promote the immunological tolerance and for the renal graft, and also to help preserve the graft function and reduce the risk of graft loss. Very importantly, also, we hope to reduce with that program and that product the need for systemic immunosuppressive therapy. So the rationale for using regulatory T cells is regulatory T cells are specialized white blood cells important in helping the body's immune system to function normally. Their main role is to regulate and reduce unwanted immune responses and inflammation. So Tregs can allow white blood cells to protect the body from harm or function as kind of gatekeepers and can direct other white blood cells to cease fire to ensure the immune system does not mistakenly attack one's own healthy organs. How is that steadfast concept designed? So when a patient decides to go into the trial, a sample of his white blood cells is taken and prepared as a personalized cell therapy, so genetically modified to express the HLA-2 receptor. Then the patient gets transplanted, and after some time, the individual product for him, the TX200 study drug, is infused again to this patient. So the steadfast participants timelines, as said, a patient who decides to enter into the trial is getting screened and tested, then gets the leukapheresis, so this blood sampling of white blood cells. The product is engineered and the patient gets his transplant. And then after some weeks, the TX200 infusion takes place. The patient is then followed up with a normal study follow-up procedure. The control patients will undergo the same procedure without getting the study drug. What do we expect to learn from the steadfast study? So in renal transplantation, we hopefully want to show that CAR-Tregs are a safe treatment for kidney transplantation, that CAR-Tregs allow the donated kidney to function while sparing the need for these strong immunosuppressive medications. And beyond then, we will also get invaluable knowledge about antigen-specific CAR-Tregs, about their safety and tolerability, about also the proof of mechanism in patients, like localization of that product in the body, the activation and the stability of the Treg function, as well as the persistence of the cells in the circulation, and also the multiple mechanisms of action for immune regulation. So what are the exclusion criteria? Inclusion criteria are male and female patients between 18 and 17 years can enter the trial. They should have the diagnosis of end-stage renal disease and currently are waiting for a new kidney from an identified living donor. The participants should await a single organ recipient, a kidney, and they should be HLA-2 negative and able to undergo the leukapheresis, which is the sampling of the cells for the program. The exclusion criteria are HLA identical to the prospective donor. Participants with a prior organ transplant are excluded, and participants considered high risk based on an immunological test. For the donors, they should be ABO blood type compatible, and for the donors of 2x200, they should be HLA-A2 positive. So what are the outcomes of this trial? As said, the primary outcome of the trial is the safety and tolerability of the TX200 infusion evaluated by incidence and grade of treatment emergent adverse events and serious adverse events. So this will be taken for a period of 28 days after the treatment. The secondary endpoints will be the effect of the product on an acute graft-related outcome and on the long-term safety outcomes. So from the day of the infusion through the end of the study, this will be assessed. And also, hopefully, we will see the reduction of immune suppressive medications being possible with that drug. From the day of the infusion through the end of the study, we will assess whether there is any improvement with the product. Localization of the 2x200 is also a very important part. Will our product find its target organ, the kidney? And this will be evaluated specifically in week 16, but also after that. And last not least, the effect of TX200 on the chronic graft rejection. So currently we have 4 sites in 4 different countries for the Steadfast trial open so far. Yeah, with that I would like to end my presentation for the moment, and I'm happy to take your questions, and I'm grateful and would like to thank you about the participation.
Ms. Schreib, I have a question for you. In order to change status quo kidney care, we must first change how we diagnose and treat kidney diseases. AAKP is a member of the Personalized Medicine Coalition and is seeing significant advancements in personalized precision medicine. Do you feel this is the future of kidney care?
Well, that's a great question. The promise of a cell therapy like TX200 offers the kidney transplant space is that it would reduce and eliminate the need for immune suppressive regimens with a one-time treatment. And this seems like a very positive promise to the patients.
Katharina Schreib, I'd like to thank you on behalf of the American Kidney Patients Association and George Washington University School of Medicine for your time and your presentation. Thank you.